Hello, everyone. In this lecture today, I'm going to talk to you about what is Kaplan Meier curve and how to do the interpretation of Kaplan Meier curve. Kaplan Meier curve is a graph that is used in survival analysis to estimate the probability of survival or survival rate over time. This here is an example of Kaplan Meier curve for two drug treatments: blue curve for drug A treatment and red curve for drug B treatment. In Kaplan Meier curve, we have survival rate or percent probability of survival in y-axis and time period in x-axis. So then what is survival rate? Survival rate is the proportion of patients who remain alive after a specific time period. For example, for drug B treatment, survival rate at 20 months time period is at 60%. For the drug A treatment, survival rate at 20 months period is below 100% or above 80%. In Kaplan-Meier curve, we have flat lines indicating no events or no deaths, and then we have drops or these step downs. Okay, this is flat line and then step downs. Step downs indicating more events or events at that time point. So bigger drops means more events at that time point, and frequent drops means worse survival. You can see for both red and blue curves, we have both flat lines and step downs, indicating flat lines indicating no events or no deaths, whereas step downs indicating deaths of the patients. And in Kaplan-Meier curve, we also have tick marks. As you can see here, in the blue curve and also in the red curve, we have these tick marks. So these tick marks actually indicate censored patients. That means these are the patients who left the study or had no event by the last follow-up. So now, looking at these curves for drug A treatment and drug B treatment, both blue and red curves, so what do you think which treatment led to better survival? To do the interpretation of this, as you can see that for the blue curve for drug A treatment, which has remained higher throughout the treatment compared to the drug B treatment, indicating drug A treatment resulted in better survival. Whereas a red curve for drug B treatment, it drops faster. And earlier, this means that drug B has more events and worse survival. As an example, at 70 months time period, you can see here the survival rate for drug B is actually around 10%, whereas at 70 months time period, okay, for drug A treatment is around 50%. So clearly, drug A is the drug that one should choose for the treatment of the patient compared to drug B. Thank you.